Imagine this. You're in the moment, hearts racing, but instead of bliss, agony, sharp, burning pain that turns what should be ecstasy into torture. Watching relationships crumble, self-esteem shatter, and joy fade away. Tears in the bathroom, fake smiles in the bedroom, endless not tonight excuses. It's heartbreaking, it's real, and it's destroying lives. But what if I told you science has answers? Stick with me for this next few minutes. For millions of women, what's supposed to bring love, connection, and pleasure brings pain instead. Imagine wanting to feel close, but every touch burns. Every movement feels like knives. And you can't even talk about it because you feel broken or ashamed. Why does sex hurt for so many women? If you've ever asked yourself, why does it hurt? You're not alone. Studies show that up to 1 in 5 women experience pain during sex at some point in their lives. Yet, most suffer in silence. Today, we're going to uncover why sex hurts for most women. And more importantly, we're going to give details of 5 science-backed fixes that can help bring back pain-free, genuine pleasure. Hi everyone, welcome back to InfoHub today, where we dive deep into real health topics people rarely talk about. And this one, painful sex, is very real. Doctors call it dyspareunia, but behind that clinical word are real emotions: fear, frustration, even guilt. A young mom avoiding her partner because every touch feels like fire. An empty nester rediscovering love, only to be stopped by menopause's cruel twist. Or a vibrant woman in her prime, battling invisible scars from past trauma. These stories break my heart, but they don't have to be your ending. Hi, I'm Dr. Dixon. When women come to me saying sex hurts, they've usually been suffering for months, even years. It's not rare. It's just underreported. According to the American College of Obstetricians and Gynecologists, nearly 20% of women experience painful intercourse, a condition known as dyspareunia. But that number is likely higher. Cultural shame, fear of being judged, or past trauma often keep women silent. Among women aged 20 to 29, about 1 in 10 report pain. Among those over 50, 3 in 10. And across all ages, one emotion echoes louder than pain itself: isolation. But to understand why it hurts, we must first look under the surface, not just at the body, but the intricate symphony of hormones, muscles, nerves, and the mind. Pleasure begins not in the genitals, but in the brain, through anticipation, trust, and arousal. When that harmony is disrupted, pain replaces pleasure. Let's start with why it happens, because when we understand the why, we can finally start healing. The 5 major causes of painful sex. 1. Vaginal dryness, the friction factor. This is one of the most common causes. It happens when there isn't enough natural lubrication. It can be caused by low estrogen, especially after childbirth or menopause, certain medications like antidepressants, or even stress. Let's break it down. 1. The role of lubrication. The vaginal walls naturally produce moisture through tiny glands and blood flow during arousal. When arousal is rushed or hormones are low, dryness sets in. Friction increases, microtears form. The body starts to associate intimacy with pain. 2. The pelvic floor. These muscles support the bladder, uterus, and vagina. When relaxed, they open like a gateway for pleasure. But under stress or trauma, they clench like a fist. That unconscious tightening can make penetration feel like hitting a wall, a condition called vaginismus. Nerve sensitivity. Chronic infections, childbirth, or even certain surgeries can irritate pelvic nerves. This leads to a hypersensitive state known as vulvodynia, where even light touch feels like fire. Hormonal shifts. Estrogen keeps vaginal tissue elastic and moist. But during menopause, breastfeeding, or from birth control use, estrogen drops, leaving tissue thin. Without moisture, friction increases, and that friction equals pain. If this resonates, hit that like button now and subscribe. Let's continue. 2. Muscle tension. The invisible grip. Sometimes, it's not the skin that's the problem, but the pelvic floor muscles. When these muscles tighten involuntarily, often due to anxiety, trauma, or past painful experiences, penetration becomes extremely painful. This is called vaginismus, and it's more common than you think. The pain loop. Once pain occurs, the brain learns to expect it. It's a survival mechanism, but in intimacy, it becomes a curse. The more you fear pain, the more your body prepares for it, by tensing and reducing lubrication. The psychological web. Behind physical pain often lies a tangled web of emotions: fear, guilt, shame, and trauma. Painful sex is rarely just physical. Dr. Nia Lambert, psychosexual therapist, once said that many women carry memories of rejection, abuse, or a sense that their pleasure doesn't matter. The body remembers those things. It protects itself by tightening. The amygdala, the brain's fear center, lights up during anxiety. When triggered during intimacy, it blocks oxytocin, the bonding hormone, and increases cortisol, the stress hormone. The result, dryness, tightness, pain. Over time, this becomes what scientists call the pain expectation loop. Each painful encounter reinforces fear, and fear reinforces pain. Breaking this loop requires more than medicine. It requires retraining the mind. 3. Infections and irritation. Yeast infections, bacterial vaginosis, or urinary tract infections can make the vaginal tissue supersensitive. Even after the infection clears, inflammation can linger, making sex uncomfortable. 4. Hormonal imbalance. Hormones control lubrication, elasticity, and sensitivity. So when estrogen levels drop, during breastfeeding, menopause, or from birth control pills, it can thin the vaginal walls, causing tiny tears or burning sensations. 5. Emotional and psychological causes. Sometimes the body is ready, but the mind isn't. Stress, fear of pain, or relationship tension can subconsciously cause the muscles to tighten. And that's the heartbreaking part, because it's not in your head. It's a physical reaction to emotional strain. 5 science fixes for pain-free pleasure. Now that we understand the causes, let's talk about solutions. Real, science-backed ways to fix the pain and restore pleasure. Fix number 1, relearn arousal. Slow as science. Studies show that arousal time directly affects lubrication. Rushing into sex without full arousal is one of the fastest routes to pain. Try focusing on non-penetrative touch, massage, kissing, or guided breathing for at least 15 to 20 minutes before intercourse. Your body needs time to prepare, and that's completely normal. Fix number 2, bring in the right lubricant. Not all lubes are equal. Choose water-based or silicone-based lubricants without alcohol, glycerin, or fragrance. For chronic dryness, moisturizing gels with hyaluronic acid or vaginal estrogen creams prescribed by a doctor can help rebuild natural hydration. Fix number 3, pelvic floor therapy, retraining your muscles. Pelvic floor physical therapy isn't just for postpartum women. A trained therapist can teach you how to relax tight muscles, use biofeedback, and even perform gentle dilator training to retrain the body to stop associating penetration with pain. Clinical studies have shown this can significantly reduce pain for women with vaginismus and muscle tension. Fix number 4, heal the hormones. If hormonal changes are behind your pain, the fix might be medical. A doctor might recommend low-dose vaginal estrogen, DHEA suppositories, or selective hormone therapy. Pleasure starts with relaxation. Research from the University of British Columbia shows that mindful foreplay lasting at least 15 minutes increases blood flow and lubrication dramatically. Arousal isn't optional, it's biology. Start with breathing, sensual touch, and communication. Think connection first, penetration last. You can also check the list of lubricants and foreplay gears from the verified store on the link beneath this video. Hormonal balancing and medical support. Hormonal changes can be treated through prescription or natural support. Options include low-dose vaginal estrogen creams or rings, DHEA vaginal inserts, phytoestrogen-rich foods like soy, flax, and sesame, omega-3 supplements to reduce inflammation. But every woman's chemistry is unique. Consultation with a gynecologist is essential. Natural options include foods rich in phytoestrogens, like soy, flax seeds, and sesame, or supplements like black cohosh, though always check with a professional before starting anything. Fix number 5, mind-body connection. Rewire the pain loop. Sexual pain often becomes a learned response. When your brain expects pain, your body prepares for it by tightening muscles and reducing lubrication. Therapies like cognitive behavioral therapy, CBT, mindfulness, or sensate focus exercises can help break this cycle. In simple terms, retrain your brain to trust pleasure again. Real talk, you're not broken. If you take away one thing from this video, let it be this: you are not broken. Painful sex doesn't mean you're weak or that something's wrong with you. It means your body is asking for attention, not punishment. Talk to your doctor. Be honest with your partner. And most importantly, don't give up on intimacy. Healing is absolutely possible, and you deserve to enjoy every bit of it. If you found this video helpful, please give it a thumbs up and subscribe to our channel at InfoHub today to stay tuned for more health and wellness tips. Your support helps us keep making videos that matter. Thanks for watching. And remember, your health, your body, and your pleasure matter.